our focus, and myself and my collaborators were really focused on better understanding what was the average time to diagnosis across a lot of different cancer types. In reality, in the US specifically, there's not a lot of standardized guidelines on diagnosing cancer as compared to maybe other countries. There's countries like Denmark, the UK, they have very defined, established processes. But in the US, there aren't standardized processes that many people consistently follow. And there's a lot of gaps, a lot of data gaps in the literature in the US, and understanding how long does it take to essentially from the moment we see them present to a healthcare institution to get that diagnosis. So we essentially wanted to do this, and we wanted to do it across a lot of cancer types. There are a few papers, but they're limited and they're usually focused on one cancer. We ended up doing this in a very large claims database. And we chose some more recent years, so 2018 to 2019. And we essentially looked for people with any kind of cancer, and we looked backwards to really figure out what was their first entry point into the healthcare system, so we could understand what was the time in between that first entry point and then ultimately the diagnosis date. And we were looking at any type of diagnostic procedure to really understand what were the steps undergoing and under the process of identifying that patient as being diagnosed with cancer. Those things could have been imaging procedures like CTs, MRIs, PET scans. They could have also been blood and urine labs. So we were looking for stuff like that, for ultrasounds. And ultimately what we found was, we found about 400,000 cancer patients. The most common cancer patients we found actually were primarily breast, I believe. And we also found, let's see here, I'm just bringing it up. For myself, we also found that breast was about 25% of the population, about 18% was prostate cancer, and about 12% was lung cancer. And really across all the cancers we saw, the mean time to diagnosis was about 5.2 months. And the standard deviation was quite wide. It's about 5.5 months. And the median actually was about 3.9 months. The range of these, the interquartile range, as we call it, was 1.1 to 7.2 months. But there was wide variability in the time to diagnosis across cancers. We actually found that in bladder cancer, it was only about 120 days average time to diagnosis. But when we looked actually at multiple myeloma, it was closer to 229 days. And there could be a lot of reasons for why we see a lot of heterogeneity. Our focus was on really establishing the mean time. And of most importance, just one last note on what we found. We found also there was a notable percentage of patients where the time to diagnosis actually was longer than 6 months, about 16% of our population. And it actually included some distinct cancer types. Those included kidney, colorectal, gallbladder, esophageal, lymphoma, stomach, and multiple myeloma. These populations actually had more than 1/4 of their patients with the time to diagnosis greater than 6 months. So essentially, by doing this across a lot of cancers, using a similar methodology and focusing on the U.S. population where there was limited research, we found perhaps that there was a long time to diagnosis, especially in certain cancer types. And we really feel that maybe perhaps some development or modification of policies and guidelines, and even interventions, healthcare technologies that can maybe streamline this diagnostic process, may help us improve outcomes. Because essentially, the longer the time you wait to get to diagnosis, the worse outcomes you have, the worse survival you have, the more adverse events you have. Essentially, we need to find them sooner and we need to get them diagnosed sooner. That'll reduce resource burden. That'll help our economic situation, but it'll also improve patients' quality of life and quality of view.